Hi, my name is Dr. Bruce Crawford. I am a periodontist with over 25 years of experience helping patients throughout Florida live a better life with a healthier mouth. For the past couple of years, I have been utilizing a revolutionary new minimally invasive procedure to correct gum recession and associated sensitive teeth. So today, we are going to cover the causes of gum recession, your treatment options, how to prevent further recession and tooth loss, how you can finally have a cold drink again without pain, how to minimize the long in the tooth look. Bottom line, by the end of this presentation, you will know exactly how to have an overall healthier mouth. This is the same procedure that worked for one of our patients, Lori. Before seeing me, Lori had to have grafting with a painful cutting and unpleasant suturing to help treat her gum recession. And I quote, she said, "Dr. Crawford does one little pinhole to do the work on your gums. Before Dr. Crawford, I had trouble eating oranges, drinking lemonade, acidic things really hurt. After Dr. Crawford's pinhole procedure, I can eat anything I want. I would definitely recommend Dr. Crawford. He saved my smile." Now, I share Lori's experience with you because I want you to know this new type of procedure does work and is extremely less painful. You can also always visit our website to watch more testimonials from actual patients. I'll get you more details on that later. If you are like me, chances are you will have some questions throughout this presentation. So if you have questions, simply type them in as you have them. I want you to turn off your cell phone, close your email, and shut down Facebook. Give me your focus and pay close attention to this presentation today, because the information you are going to learn can help you avoid pain and certainly help you have a healthier mouth. You absolutely don't want to miss anything. Clear all your distractions and focus on what I am sharing with you. I promise you will be so grateful you did. So why is this presentation so important right now? If you are watching this presentation, chances are you have sensitive teeth or gum recession or think you may have gum recession. Maybe your teeth hurt when you get a dental cleaning because your roots are exposed without even you really knowing it. Gum recession and having sensitive teeth is a very common problem in young and old people alike. Additionally, the quicker it's diagnosed and treated, that allows you to have less gum loss and less bone loss. The bone is what's holding your teeth in place. Oftentimes, gum recession goes untreated because it very often happens subtly. So this presentation is more important than ever because I want to help prevent any teeth or gum loss for you. Well, I want you to imagine if you could wave a magic wand and in one visit be able to have all this corrected. You may have been told you need a gum graft where they take tissue from the roof of your mouth in order to correct recession. Well, we have a minimally invasive technique where we don't have to create another wound site. We don't have to take tissue from the roof of your mouth or use cadaver tissue. We make a tiny pinhole opening and move the gum down to cover the roots without any cutting and typically without any sutures. But first, let me ask you a question. How will your life be different if you don't learn more about this new procedure? If you let gum recession go without treatment, your chance of tooth and gum loss increases significantly. The good news is, I'm going to show you exactly how easily it is to fix gum recession and sensitive teeth without painful grafting and cutting. This technique is called the pinhole gum rejuvenation. We are the first and only periodontist in the Tampa Bay area that offers this solution. So at this point, you may be wondering, why am I even teaching this? Well, most people are unaware there is another way to correct gum recession without cutting the roof of your mouth. Our office focuses on providing minimally invasive procedures for all periodontal care. Ultimately, I love helping people. I want to give you the information you need to determine if the pinhole gum rejuvenation is the right procedure for you. If you decide you want to have me perform this procedure for you, that would be great. But if not, I promise that what you're going to discover over this next 15 minutes or so is still absolutely going to be beneficial to you. Okay, so let's start with a little bit about my background. So I have been around dentistry my entire life. My father was a dentist. I got to see firsthand how my father got to help people every day. I remember patients hugging him, thanking him for helping them with their smiles and getting them out of pain. After going through 4 years of dental school at Washington University School of Dental Medicine, I specialized to become a periodontist and went to Boston University. It was around 1990 and implants were just starting to come out. I was really interested in being not only able to help people save their teeth, but even in situations where someone had no teeth and has lost all hope with ever having a healthier mouth again. Being able to use dental implants changed that, and that's why I decided to become a periodontist. Even after 25 years, it never gets old changing people's lives and giving people hope. There's not a better feeling in the world than when someone comes up to me and says, "Dr. Crawford, you have really changed my life." I just love that, and I enjoy helping people every day regain hope and confidence and improving their life. Additionally, I always provide the latest and most innovative technology and procedures to perform the least invasive procedures for our patients, such as the pinhole gum rejuvenation or laser periodontal surgery. Now, I have a limited amount of time with you on this presentation, and I'm going to give you all I can during our time together. My number one goal here is to give you the information you need to determine if what I'm talking about on this presentation makes sense to you. I will show you how the pinhole gum rejuvenation can correct gum recession in one visit. And at the end, if you decide you want to meet with me personally, I will show you how you can schedule a consultation. So let's get started. There are many causes of gum recession. First, and most common, is aggressive scrubbing of your teeth and gums during everyday brushing. Number 2 is the clenching and grinding of your teeth. And the third cause is previous orthodontic therapy. These are the most common 3. Additionally, periodontal disease, genetics, inadequate or insufficient preventive care, hormonal fluctuations caused by puberty, pregnancy, or menopause, and piercings in your lip or tongue can also cause gum recession. So, you can obviously do nothing and let this go untreated. However, in the long run, this will cause you more pain and potential tooth or gum loss increases significantly. If untreated too long, this could also require multiple surgeries to correct the problem. A second option is a connective tissue graft, which is basically cutting tissue from the roof of your mouth and suturing it to your gums, which your gums have to also be cut. A third option is to use cadaver tissue as a graft source, but with this procedure still requires some cutting and many sutures. Your second and third options are more traditional options for gum recession. Now, with this revolutionary technique, your fourth option is the pinhole gum rejuvenation procedure, which literally is a pinhole made in the gum. And through microsurgical instruments, the gum is moved gently to cover the roots of your teeth where it once was when it was healthy. Here is a side-by-side comparison to illustrate the difference. With conventional gum grafting, you can see all those sutures, and not to mention the cutting of the tissue from the roof of your mouth, compared to the pinhole gum rejuvenation procedure, in which there is only a tiny pinhole for the procedure with gently moving of the tissue downward. This innovative new pinhole gum rejuvenation procedure is a procedure that is much less painful than conventional gum grafting. Oftentimes, people ask me, does either procedure hurt? My response is, typically the second and third options I describe with grafting is more painful and there is more swelling and delayed healing in comparison to the pinhole gum rejuvenation, where your results are instant and with much less pain. There is also less swelling in comparison. The pinhole gum rejuvenation is still a surgical procedure, and most of our patients report some swelling with minor discomfort for several days. I'd like to share with you specifically what one of our patients had to say. This patient had been a dental hygienist from another office in the area for over 25 years. Her name is Gloria. She had gum recession on the upper and lower front teeth. For years, she was putting off treatment. All of a sudden, one day, it seemed her gums got worse really quickly, so Gloria started researching online and loved the idea of the pinhole surgery versus traditional grafting. Gloria said, and I quote, "Coming in to see Dr. Crawford was a great experience. Everyone makes you feel very comfortable. They explain everything. Dr. Crawford and I both decided that the pinhole procedure would be best for me. The procedure was excellent. I had no pain whatsoever. Dr. Crawford did prescribe me pain medication. I took one pill that night just in case. And I didn't need it. I didn't take any more. I had my procedure late last year and my results have been fabulous. I have had no problems in my mouth since after the procedure. I am comfortably eating everything. I would recommend my patients, friends, family, and anybody to Dr. Crawford and his staff. It was just an amazing experience for me. Additionally, at our practice, we try to make the procedure as comfortable as possible. We provide you a comfort menu, from a massaging chair to a warm blanket to noise-canceling headphones to eye masks to anything we can to provide to make your procedure as comfortable as possible. Another common question I get asked is, how long will it take? Well, in terms of surgical time, it could take as little as 30 minutes and up to 2 hours for an entire mouth. In terms of healing time, the results are instant, and the swelling may last for several days. Another question I'm commonly asked is, are these procedures expensive? The pinhole gum rejuvenation procedure is no more expensive than conventional grafting techniques. This procedure is also typically covered by most dental insurances. We also accept all major credit cards. Additionally, we offer 0% financing. Ultimately, we do our best to create a plan that fits your budget. So at this point, you are probably wondering, who can help you with this? Presently, I am the only periodontist in the Tampa Bay area who provides the pinhole gum rejuvenation procedure. You have to be certified by Dr. John Chow, the inventor of this procedure. I'd like to show you a before and after. On the left, you can see the before with the longer looking teeth and inflamed gums compared to the after on the right with healthy gums and less of that longer tooth look. So you are probably wondering, Dr. Bruce, I love what you're talking about, but will the pinhole gum rejuvenation procedure work for me specifically? I'd like to invite you to a consultation with me so we can determine if you are a good candidate for this procedure. This procedure is for you if you want to correct gum recession, prevent further gum and bone loss, and have a prettier smile and a healthier mouth. In fact, the Mayo Clinic performed a study that showed people who have a healthy mouth and teeth live longer, healthier lives. So why am I doing this? Remember, I share with you my passion for helping people. My team and I want to hold your hand throughout this process. I want to personally meet with you to understand your needs and desires and want to answer your questions. Ultimately, I want you to stop suffering and feel better now. I simply want to help you. I invite you to schedule your appointment. Come into our office right here in St. Petersburg. Meet my team and meet with me. The consultation is $115, but it is typically covered by your dental insurance. We do work with most dental insurances and even submit the paperwork for you. So head over to www.pinholeconsult.com to schedule your consultation or call 727-308-5420. When we meet in person, I will be sure to address any of your concerns and answer all of your questions. Also, if you typed a question during this presentation, one of my team members will follow up with you as well. I look forward to meeting you and seeing if you are a good candidate for the pinhole gum rejuvenation procedure. Thanks again.